So I think part of it, just looking and beyond even just the adult acute care specialty, is really just the nurse practitioner role in itself, and really seeing where you identify what kind of patient population you really feel like you work the best with. First, is it adults, is it kids, or is it a mix of the two? And then second, obviously, is the setting. So do you see yourself more in an acute care hospital-based setting or more in the outpatient role? And I think that kind of gives you some pretty good direction as to what you'd kind of like to do. One of the things when I have conversations with potential students who often are obviously newly undergraduates or new into the nursing career, and so for the vast majority work in inpatient settings, right, because that's where we find most new undergraduates work, is thinking about where do they pick their ideal job, and then if they can't get that ideal job, what's their next ideal job? Because I think it's very easy for me to say, I want to work in the emergency department, and that, or I want to work in the ICU. But if you don't think, all right, if I didn't get that, do I find myself more in primary care? Is that really more what I like? Or do I really still want to be in the hospital taking care of those patients? I think that kind of, when I work with, with students or potential students, kind of helps them articulate where they want to be. Sometimes you get into that conversation, they're like, oh yeah, maybe that is where I kind of need to be. And then so for students in my program specifically, we train students to work in obviously ICUs, emergency departments, inpatient settings, but the discipline also talks about kind of these highly specialized outpatient settings too. So maybe outpatient specialty ortho or outpatient specialty cardiology or whatever it happens to be. Those settings are still hospital affiliated, right? It still leans more towards especially an inpatient side as opposed to primary care, which is much more disease prevention. So obviously it depends on what your program plan is, but for the most part, most of our students start with some of the core courses that all of the nurse practitioner students take, right? So advanced pharmacology, advanced pathophysiology, advanced health assessment. There's 2 semesters basically of those types of classes, and then move into the specialty classes, right? So we have a skills course, right, where students are learning how to interpret diagnostic testing, things like EKGs and chest x-rays and CT scans. So understanding those aspects as well as doing procedures, right? So suturing, abscess, orthopedic, splinting and casting. Our acute care students are learning how to do chest tubes and advanced airway intubations and central lines and those types of things. Those all prepare students to then get into the clinical environment. So they also have classes, so two foundation like disease management classes. So how do we manage heart failure? How do we manage diabetes acutely? How do we manage strokes? So then all of those then lead up to the clinical experiences, right? So they've had all that foundation and jump into the clinical experience as well. My expectation for when students get into clinical is that they, especially with their first clinical experience, are really then honing the level of advanced knowledge and pulling all of that together, right? So how do we create a diagnosis? It's all those different elements, that contribute to that. And then how do I form a diagnosis, identify what it is, and then to develop a plan of care kind of based on that. And then we see progression, obviously, as they move through the clinical experiences as well. I think it really is. And actually, I think that's one of the highlights of our program comparing other, programs that are in the area that I know that don't necessarily have an office who's dedicated in working on clinical site placements on behalf of the students, both with their master's students as well as the DNP students, because I think it's really challenging, for us to do that or for them to do that. So what we do is basically a semester and a half before students enter into clinicals. I talk to the students and ask them, what do you want to do? What clinical areas are you interested in? What's your background? That kind of stuff. And then we really do our best to do a good job of matching all of our students with what their area of interests are. I think the resources that we have here at the university are phenomenal. Obviously, we have a brand new, relatively new clinical learning center, which is a great resource for us to have. We've invested a lot of time and money in making sure that we have a good product for our acute care nurse practitioner students. I mean, really, anything that's affiliated with any health system, you could think about it really. Again, from the ICUs and emergency departments to working in the operating rooms with surgical services. We have some that go on and, whether they finish their MSN and then want to do either PhD or get their DNP. Obviously, have a lot of students that do that, or even in the midst of their program decide that the DNP is the right thing to do, and so end up adding on some of that to their program while they're here. We have students that have gone on to do some other specific fellowships, palliative care fellowship. We've had students that have done critical care fellowships at other universities and other health systems. Other students that have gone on to do some teaching, at other universities too, and even here, actually. This environment really prepares students to work in a lot of different settings. A lot of what comes out of my mouth is telling students that my goal for them as graduates of this curriculum are not just, I use that word, to be just they do their 3 12-hour shifts and that's done, right? But really to be clinical leaders in their environment, and then leaders in this discipline, and think about how we represent the things that we do as adult gero acute care nurse practitioners, and really continue to promote, the things that we do best.